Welcome back. And the next company presenting is FRISQ with its CEO, George Thaw. Please go ahead, George.
Thank you. I'm very excited to talk to you this afternoon about FRISQ. When we were putting together the presentation and trying to find images of what FRISQ was, we came across the slide on the picture on the top left, and it sort of summed it up in some ways. You've got a whiteboard, with the clinician on the right hand side of that picture, and on the left hand side, you've got a screen, and that's really what a significant amount of modern healthcare is about today. You have these archaic, but to be clear, working systems that can be digitally transformed and drive great efficiency at the center of them. And that is the core of what FRISQ does. It's easy to talk about all of the things that go on around the side of it, but the actual core of health is something that we work at and improve. Next slide, please. So I talk about the core of health delivery. FRISQ basically is an ability to be able to sit and create and manage pathways for care over a patient's journey from the beginning to end of a treatment cycle. And this can be long-term care, this can be episode care, but it is a process. And the ability to be able to sit and create that process, in a way that engages the patient, and the patient as part of a team will lead to better outcomes. And this is, we use the term core, but this really is the very center of healthcare today. On the left-hand side, very popular and known at the moment are, video doctoring, chat, devices, appointment bookings. There are a lot of solutions out there that do that, but that is a fraction of the overall healthcare technology landscape and spend. The core of it are basically the steps that take to be able to get people better. And these at the moment, whilst there are consistent protocols for it, they are not based around the individual. We might both have diabetes, but our treatment could differ based on sex, BMI, ethnicity, age. There are a rack of things that would actually mean that we would get or should have separate plans. And FRISQ is an ability to be able to deliver these separate plans for patients aligned to long-term treatment. And I'll come to why I say long-term later on. Ultimately, this leads to better outcomes. Now, clearly what we do lives in the center of health. And there are these EMRs, these medical records, electronic medical record systems, or they're called electronic health record systems. These are the large systems that live inside the world of health. And we coexist with them, taking elements of information and passing information back, but really being patient-centric. And as opposed to looking, down one particular hole at any one time in terms of what's the next step, what's the next step, what's the next step, we turn it and look at it all the way through from beginning to end. Starting here are all the things that are going down that journey. And it's one thing to have a passenger on a train and told when they arrive at the station what to do next. It's far better for their outcomes that they actually understand all of the stops along the way and what may or may not be asked of them, so they can be part of that decision-making process. And the reason I say that is we know that level of engagement drives better outcomes. Next slide, please. I've had the privilege of working in medical healthcare for over a decade, from the first project, which was a national program for IT in the UK. But rarely do you get to be able to sit and work in a business that can tick so many boxes that are core to the betterment of society, of patients, and of the long-term treatment of people. Care providers, they are going to get improved efficiency, and the ability to be able to sit and look after people. So the people inside the medical world get insight. The fact that they will see, as opposed to after 1,000 operations, they will be able to see after 50 operations what they can do better, what was leading to a better outcome. For the patient themselves, that they've got insight into what that journey is. And ultimately, to the payer, be that private and insurance company or the taxpayer, because you're providing core efficiencies. And it is so rare that you get to be able to tick all of those boxes, that you have the medical world, you have the patients, and you have the payers. And from the patient point of view, we're all bizarrely potential patients, current patients, or has been patients. So for all of us, this is germane to every single one of us. And as I say, a privilege to be able to have a product that ticks all of those, can address all three of those with merit. Next slide, please. So in terms of how we connect, we provide a system that visually shows what are the next steps on any individual's treatment plan, and where that individual sits, either within a clinic, within a ward, within a hospital. And that is connected to the records management systems on the left-hand side. So I'm sitting there as a clinician, and I know. And even if it comes to a change inside a hospital, as the original photograph that I showed was, I save an hour in my handover process by having everything digitally before me. I know exactly who I've got. I know everything that I need to know about them. I know next steps that I need to execute during my next shift, my next clinic. And then as I exit that one, that information is ready for the person that's going to take over my role in the next 8-hour shift. That information is also shared where pertinent and available to the patient. And a lot of these systems aren't just in hospital. So a lot of the times, if you take long-term management from mental health all the way through to diabetes, to be able to sit and say, if it's mental health, how do I feel today? Do I feel better than yesterday? To be able to gather that information, to be able to sit and engage the patient, to be able to get the insight means we're going to be able to sit and get better outcomes. So where necessary, during a treatment cycle, to be able to get 1 or 2 or 3 or even daily pieces of information from them, which can be on the device, could be online, it even could be via a text, doesn't need to be smart and able, allows us to be able to sit and get a better treatment. And we know that having this, that engagement, just having the device or the opportunity to do so, drives better outcomes, because you have people who now want to be engaged, who want to be part of the medical team. And on any spectrum, there will be people who are ultra and want to know everything in advance, but there will also be some people that just choose not to engage, and that is absolutely their right. But we know for the significant majority of people, they want an ability to be able to sit and engage, and they want to be able to sit and see the future of their healthcare plan, not just the one particular room that they've walked into, make one decision about that and move on. And then ultimately, from the patient point of view, what are all the other devices that can provide input? I have this, I can send input from this to my cardiologist, I can send steps. There are multiple elements that, again, will enrich the amount of patient data, which ultimately will mean a better insight to medical teams and therefore better outcomes. Next slide. So in terms of our opportunity to improve productivity, to take all of these plans and to be able to sit and move them from one environment to the next is also key. A lot of the larger systems live in one environment, so they would live inside a hospital. You now go out into the community where there would be a different system. And a significant amount of time it was interesting in some of the conversations we've had with doctors and with patients. One quote stuck out to me when speaking to a patient that said they'd spent 20 minutes with a doctor, which was the allotted time, and they'd actually timed, and they said 17 minutes of it were with the clinician looking at a computer. They weren't actually engaging with them, because all of the content that they were cutting and pasting and copying and PDFing was done here. And they actually wanted the clinician to be able to sit and engage with them. So to be able to get that information that's pertinent when the person enters the room that's there before them would just even if it gave 5 incremental minutes to the system would make a difference. And then again, once they've left the clinic and they go back to home, to be able to sit and take that care plan with them. So it isn't something that lives in one silo and then is recreated in the next silo and then is recreated in the next silo. To have them all joined together is so significant. And FRISQ as a solution platform allows that to happen. And as every single level of engagement gives greater insight collectively to what the process is, and therefore how to be able to get more effective outcomes and better treatments. So ultimately, you've got doctors doing what doctors love to do, and that is to actually work and treat with patients, not being, very advanced administrators. And it is common around the world in terms of feedback that that's actually what they want to be able to do. So they do less of the indirect and they do far more of the direct work going forward. Next slide, please. So I've mentioned patient engagement, and this was some work that we did earlier last year in terms of patient engagement, and this was versus a US, significant US systems. And it was fascinating to see that using the FRISQ platform and the patient engagement tool was driving such significant results. And we ran this several times, and these were delivered to us by the customer. We were bowled over, but this is they continued to iterate that this is what was affecting the significant outcomes, that they had patients that were engaged in their treatment plan, that were turning up. They'd already had the prescriptions. They'd got x-rays if they needed to, so they were ready for a procedure, that someone had made sure that they had done their steps, they had taken their medication, that they were filling in their mood and their feelings charts for in the state of mental health. That was leading to just better. It's not just the fact that you get better outcomes in medicine, it's the fact that ultimately you can learn how and why that you're getting those outcomes, and a lot of that is patient engagement. Next slide, please. So we are, and I was speaking at a health dinner about 2 years ago, and someone in the audience was saying, so what is the future of healthcare, vis-a-vis the technology? And I said at the time that, and I don't think I'd ever be that confident to be able to sit and say, clearly this is what the future is. But there are some plate tectonics at work at the moment that are, and these are just facts of business physics, sort of biology and man's development. We have an aging and growing population. So that curve of age is moving and growing. We also know that the tax burden and the ability to be able to sit and support that and the potential people that are paying tax are reducing. And we know that costs in medicine are rising. So you take those facts and you have such a pressure point in here that something has to give. And my contention remains, that technology, and specifically, FRISQ would allow a 30%, a 40%, even in some cases, 50% increase in efficiencies in some of the core elements that would allow both a reduction in the cost burden and us to be able to sit and treat more patients by having plans in place. And this is before you actually get to the insight that allows you to put smarter plans in place to begin with, which would lead to quicker, better treatment, ultimately people being treated in the right environment, not necessarily in hospital, which is highly costly. So those facts in terms of population, in terms of cost, in terms of certainly for public health and tax burden, that's known. So something different just has to happen. and I believe that tools such as FRISQ will be preeminent, in the next 5 years in helping make that happen. Next slide, please. We tried to gain or get a sense of the market, and we sliced and diced it many ways, and it sort of in some ways became sort of impractical to do, because sort of almost limitless is true, because we work at the core of it all, which is the bulk of where medical spend is, and we can have such a significant impact on core efficiencies that the market is vast. If I was just to take, the UK alone spends 130 billion pounds a year, plus I think it's nearly 139 billion last year, and that's without a COVID effect, of which 70% is spent on long-term chronic diseases. And that's where, to me, the efficiencies in that, and it's diabetes, COPD, pulmonary hypertension, asthma. These are a bulk of where the money is. To be able to sit and drive, an hour in an 8-hour shift, to be able to add, to do 12 patients, not 10, during a clinic. All of these things will drive significant benefits, and that is the bulk of where we play. And those figures are the same, across the developed and the developing world in terms of where the costs of core treatment are. So we feel, this is a nascent market to begin with, but in terms of the size of it, it's very, very very significant for us. Next slide, please. So we have a strong base to go from, both in terms of customers and partners, and we have learned a significant amount in the last 5 years, and specifically the last 4, which is a lot of the IP that we've gained in terms of how to be able to sit and implement these systems, how to be able to grow them, and ultimately with partners, how to be able to sit and get a route to market. So we're privileged in terms of the people that we've worked with, and then ultimately our route to market, and an ability to be able to sit and address, both by patient and potential care staff, the significant number of users that are out there that can use FRISQ. Next slide, please. So in terms of where we are, we're in a leading position. As I say, the market is nascent, or at earliest emerging in terms of what we're doing. We have first mover advantage. We have a significant amount of very complex data modeling to be able to sit and understand what these pathways are, to then understand them at an individual level, and then to be able to sit and allow them. Often when someone has a long-term disease, that they have comorbidities, there's another one that goes against it. So to be able to sit and look at multiple pathways, that becomes complex, but we have significant knowledge and IP around that. And the fact that we don't compete with EMRs, we don't compete with video chat systems, we don't compete with devices. We sit in the center and integrate with them all. And we have an ability, due to our platform, a significant ability to be able to sit and scale. Next slide, please. In terms of how we make money and create value, predominantly annual recurring revenue streams in terms of our product. We have a modular approach to the product, so there are elements. You could take a FRISQ Care core, you could take medical records or individual medical pathway systems. You could take engagement models, and they all live on their own, or you can combine them all together. We have additional revenue streams from customization, training, and implementation. It isn't a significant workforce to be able to sit and do so. Being a cloud-based model, we can spin up very quickly, and we are developing significant data insights by the modeling we're doing. And we are developing and looking at patent applications as well. Next slide, please. So in terms of our road to value creation, last year, because of the pandemic, was very insightful. To be clear, a very tough year. and rightly so, because people were focusing on a global pandemic. But it really allowed us to sharpen our focus, and we used the time very well in terms of being able to sit and tune exactly what we're going to do, and specifically, guess what, respiratory diseases, and a lot of the work that we've been doing there, COPD, asthma, and general breathing. We've got some significant projects underway. This year we commercial ramp up. So based on all of that, it's now into pilots. We'll be expanding in 2022, and then looking at what we can be doing with the data that we will have gained and the brokerage of that in 2023 and beyond. Next slide, please. I have the privilege of working with a significant team, all of which have tenure in this market space. Have worked in this environment, be it medical, be it software, and then be it in high growth. We have a tenured board with a great understanding of the Swedish market, and Lars Björk that's got a great background in terms of very high growth and taking high growth businesses to market from the US. And then in terms of just two examples of our advisors. So David Haslam, who was the head of the National Institute of Clinical Excellence in the UK, the head of the Doctors Union, the surgeons, and is a phenomenal advocate, as is Martin Ingvar, in terms of his background and the work. And those are just two of many that are strong advocates for us. Next slide. I think that put me 1 minute over. I believe that allows me a few minutes for some Q&A.
Thank you very much, George, for that interesting presentation. And like you said, now it's time for the Q&A. And we'll jump straight into the first question. When do you foresee revenue to a greater extent at FRISQ?
This year, we will start meaningful revenue streams. So it has been, as I say, 19 and 20 were a piecemeal, but based on the projects we've got, and now turning to license-based revenue, that starts this year.
Interesting. And would you say that there are more players in the market that offer similar services as FRISQ?
No, I don't. People will talk about offering care plans, and but it isn't a care plan. It's a process that is this step to this step, and they aren't actually linked together. We link them together around a disease and around an individual, and we haven't found anyone that offers something similar. And that's why I said it was a nascent and emergent market. It is a complicated one, and it often looks like people do it, and people do engagement. Yeah, they do, but engaging it around a patient-specific care pathway, we haven't found it exists, and that's what we're aligning to, because we believe that level of engagement drives the better outcomes and insights and the ultimate efficiencies in the health system.
Okay, interesting. And the next question is, are there any regions within the Swedish healthcare system that are conducting any public procurements right now that you would think are of interest of FRISQ?
So they are all public procurements are going on a constant basis, and I think the question might refer to very large procurements. So even Stockholm, the procurement that was cancelled, they will continue to procure healthcare systems, going forward, and we continue to talk with all of them about it. And it's interesting, some of the difficulties that have been had that are well publicised, I actually think support what we want to do, because whilst you can do these large things very well, they are very cumbersome, cost a fortune, are prone to fail, versus you can put modest sums into something that can actually show how you can drive efficiency. And I put my hand up and say, FRISQ can do that. So an ability to be able to sit and do it and then prove it, we feel very confident we can do that. So we continue to engage very actively with public health in Sweden.
Okay, thank you very much for today, George, for providing good answers and a good presentation. And we wish you good luck in the future.
Wonderful, thank you all.